Hi, my name is Dr. Caroline Juguna. Today, we are discussing breast reconstruction. To discuss this topic, I'm joined by Dr. Andrew Were, who's a plastic, reconstructive, and aesthetic surgeon. Karibu, Daktari.
Thank you, Daktari. Happy to be here.
So, Doc, will go straight into it and start with the basic. When we talk about breast reconstruction, what does that mean?
Yeah. So when we talk about breast reconstruction, we're talking about surgical procedures that are meant to restore the form and, in other cases, the function of the breast. And this we do in cases where we have men or women who lose their breasts, maybe because of a surgery, what you call a mastectomy, maybe to get rid of a cancerous lesion in the breast. So then we do reconstruct, and when we reconstruct the breast, we normally have different ways of doing it.
So you've mentioned breast reconstruction. Most of the time when patients have undergone mastectomy, that's the surgical removal of breast tissue. Why is that important?
It's important because the breast is an intrinsic part of womanhood, and for men also. And because there are ways of restoring its form and its function, basically giving you the breast mount back, then we do encourage women to actually to restore their quality of life, their self-esteem, and their womanhood. Then they need to have the breast reconstructed. When you talk about women,
what are the different options for patients?
So when it comes to breast reconstruction, we have two major types. Where we use your own body tissues, and that we call autologous, like your own. And there is where you use, let's say, fat from your tummy or any other part of the body to create the breast mound. Or we can use part of your muscles or skin tissue to create a mound, mostly from the anterior abdomen or from the back. And one determines whether we use that kind of reconstruction is all about your build and bulk of the muscle you have. If you have a lean build, then most of the time we recommend to do with now the second type of reconstruction, where you use silicone implants to create the mound. But then if you have enough tissue and you've medium to well built, then you can be able to actually use your own body tissues to reconstruct the breast mound.
I know you've mentioned about women. Do men also require reconstruction, or is just outletting?
Yes. Actually, 4 to 5% of men actually are afflicted by breast cancer. And you find most of them, when they come, then you're able to remove that lump and take them through the treatment just like anyone else. But the reconstruction that we see mostly in men is when we have what you call as men boobs, where we have men who go abreast, which is not natural to them, because of hormonal influence or use of steroids, or it is just genetic. Maybe you have some chromosomal disorders genetic disorders that actually predispose you to have that kind of condition. And in that case, we do what is called gynecomastia excision, where we're able to reconstruct the breast for a man to look like a male breast. So we do reconstruct for male in those instances.
And how often do men come for that? Because I have a feeling that most men don't think it's an option, or even the society, when you think about breast and reconstructing, you just think women. So how often do you see men coming for these services?
So, in as much as males, the men have poor health-seeking behavior, but in this particular case, there is no man who wants to be out there and look like a lady. Because when you have that breast mound, it becomes a societal issue, because how will people view you as a man who's having excess breast tissue? And in that case, we see actually men coming to seek those services in our institution here.
So beyond the aesthetic is also the psychological and the mental.
Yeah, the mental bit of it, because you want, when you're there with your peers, with the other men, to look manly like them. So when you have a breast, then that looks a bit out of place, and that's when those men actually come for the reconstruction.
And I know you've interacted with a lot of patients that need reconstruction. what are some of the myths that surround breast reconstruction that you'd want to dispel today?
I think the big, I won't call it a myth, but I think the challenge that we have here in our society in Kenya is not so many women are given that option, or they're advised that you can actually, after having mastectomy, where the cancerous breast tissue is removed, then it can be created back and you have your breast back. So the other one is when people think you reconstruct the breast, then the cancer will recur, which is not true, because once we have done the breast mastectomy, then we take you through treatment and we're able to follow you up and ensure that there's no recurrence. So the breast cancer can come back before we even decide to reconstruct. And the beauty about reconstruction, we use tissues from another part of the body that is not affected by the tumor. And at that time, you've undergone your chemotherapy, your radiotherapy, and you're free of the disease before we reconstruct. So the biggest challenge we have is lack of knowledge. It's actually here at KTRH, one of the leading hospitals that do breast reconstruction, is actually covered by our social health insurance fund, and the issue of recurrence of the disease, which is neither here nor there.
So people should not be scared, because as you've said, we're actually removing tissues from other parts of the body that are not affected.
And even before we do the breast reconstruction, we ensure that there's clearance of the disease, so there's no chance of it recurring.
When it comes to the reconstruction, especially after mastectomy, do we do it at the same time, where you remove the breast and you do the reconstruction, or do you do it later? The
immediate reconstruction, and there's a delayed reconstruction. So it all depends at the stage in which the tumor or the cancer was found in the breast. So there are instances where we actually do remove the tumor and start the reconstruction immediately, where we expand your skin in preparation for the reconstruction. There are those where working with the breast surgeons, they're able to spare some skin, where you're able to do immediate reconstruction with it. So there are those patients who are eligible, we do immediately, so we can be able to correct and create for you the breast mold immediately. But there are those now you have to wait a bit, which what we call a delayed procedure. Then we're able to reconstruct within 3 to 6 months.
And now for the delayed procedure, do they come one day and the thing is done, or they come several?
Okay, they come. It's a one-day surgery. You come, we were able to examine you. Maybe you want those need to go through chemotherapy, or those need to confirm the diagnosis first before surgery is done. Once that has been done, then you're able to plan for you and then do the breast reconstruction.
And in the surgery, what are some of the risks? Because I know most of us, when you hear you're going to theater, it's a scary affair. So what are some of the things that could go wrong, and how do we take precaution?
So when I came in surgery, anything can go wrong. What we do here at KU, we have one of the best equipment in the country in terms of our theaters. We are very experienced doctors who have done this again and again. So we work very closely with the breast surgeons, the anesthesiologist doctors, to ensure that you actually go through this process in a safe manner. Complications happen in any surgeries, but then nothing like threatening. And when they do occur, then the doctors plastic surgeons who work here are well equipped to take care of that. Like any other place you do the surgery, if something comes up, then you're able to manage, but nothing life-threatening. It's pretty straightforward, easy surgery. We take between 2 hours, maximum 4 hours, and you have your breast mold, and then you're able to follow you through our clinic to ensure that you then heal safely and you're able to integrate back to society.
Well, that's encouraging to know that yes, there might be a small risk, but it's worth the risk. And the doctors and the hospital will take care and be sure that all the precautions are taken. So for someone who's considering reconstruction, what is the journey like from preparing for surgery, the surgery, and life after surgery? What should they expect?
So the reconstruction is not only for ladies who have cancer. We have other breast conditions, like people who are genetically born with very small breasts. We call them tuberous breasts or micromastia. There are those who have born or when they reach puberty or after carrying a pregnancy, then they have very large breasts that create back issues. So those are other reconstructions that we do other than the breast cancer bit. But then how to prepare yourself, just like any other surgery. People do exercise, do the 10,000 steps, eat a well-balanced diet. If you're smoking, you need to quit smoking at least 4 weeks before the surgery. And that smoking is anything. It can be the shisha, it can be the cigarette smoke, or you can even be a secondary smoker. You need to quit before that. If you're someone who has, let's say, any other comorbid disease, hypertension, diabetes, then you ensure that your pressure is well controlled, your sugars are well controlled before you come for the surgery. And then after the surgery, you ensure then you continue with that healthy lifestyle for around 4 to 8 weeks. And you'll find then your surgery will be uneventful and it will go very well and your recovery will be good and will be faster.
And for someone who's gone through the surgery, how long should they expect before they go back to their normal activities?
Yeah, so normally it's between 8 and 12 weeks. Where we tell you after you've done the surgery, minimize the exercises. If someone who's going to the gym, avoid exercises that raise up your arm and stuff. But within 8 to 12 weeks, then you can actually resume the gym and your normal lifestyle. But if you come and we do the surgery this week, by next week, you can actually still go to work and work normally. So it's not something that will put you down for those 3 months. But then full recovery is between 8 and 12 weeks.
Do you have any story that stands out to encourage our listeners that, life can be back to normal after reconstruction?
Yeah, but actually, during the last year's camp, this is going to be our second camp. There's a lady who had undergone mastectomy for her breast cancer. She was pretty young, around 25 to 30 there. I can't remember the exact age, but then this is a lady who wants to get married, get back into, but then when she looked at herself, it affected her self-confidence. So when she came here, we were able to, and then she had also undergone radiation. She had not gotten her breast, but you can actually create the breast bone before you undergo radiotherapy. So it was a very challenging 50-50. In fact, when we were here with the visiting team from Canada, Argentina, Ghana, and sitting discussing about most people you want to actually attempt the reconstruction. But then we went ahead, did the reconstruction, created a very beautiful mound for that lady. And if you meet that lady now in the streets, she's really gotten her act back together. She's very self-confident. She's outside there now dating, because it's something that actually restores your womanhood, restores your self-esteem and your quality of life. So that is one of the inspiring stories that we actually had the reconstruction that year last year in KU, and it's really impacted and changed the life of that particular lady. And we are hoping in this particular camp, we're going to also touch more lives in terms of helping women get their esteem back through the breast reconstruction.
How does that make you feel, Doc, when you meet this girl who has, as you're saying, had lost hope, and even never having a relationship, and now she's out there and thriving? How does that make you?
It makes you feel good. It makes you feel that you have impacted positively in somebody else's life. That's basically what doctors are all about. It's about changing and helping others be better. So when you know there's a soul that's walking outside there that she's got her life back, she walks confidently. She doesn't have to look at a mirror twice. She knows that I'm here and I've achieved what I wanted through the breast reconstruction. Then it really makes you want to do more to help out more women so that they can actually integrate. I remember what I'd said earlier. She had not gotten this information that you can actually undergo breast reconstruction. So she had stayed for a very long time without being provided that option of reconstruction. And that's why we are trying to provide that through our medical conference that we're going to have on the breast reconstruction workshop.
So there's someone out there who's watching us and they're considering coming for this year's reconstruction at KU Teaching and Referral Hospital.
Yeah.
And maybe they're scared of the risk, they're scared of the costs, the recovery, and all those things that go through our mind when we think about surgery.
Yeah.
What would you encourage that person?
Now, what I can carry them and tell them, KU is one of the specialized hospitals we have in this country. We have very well-trained plastic surgeons and breast surgeons and a very good supportive team in theatre and in the wards. You don't need to worry. You need to just take that step of faith. Come consult with the doctors. They give you a plan that fits you and works for you. And then we'll be able to take you through the breast reconstruction in a very safe manner. Last year we did more than 30 reconstructions. All those women outside there, they're happy. They have their life back. So don't be left out. Come and we'll be able to go through the same procedure very soon.
And what conditions are we looking to treat in this year's camp?
So in this year's camp, we are looking to post-breast cancer patients who have had mastectomy done or have had part of the lumps removed. We're also trying to treat mothers who have very big breasts, what is called negantromastia, and which is causing a lot of back pain, neck pain for them. We're also going to treat the genetic breast diseases, what I talked about, micromastia, or people will be born with small breasts, but then we want to get them to have a mound that fits their body shape. Yeah, basically that's what we're going to handle most of it.
You talked about different partners or different doctors from different parts of the world. So which parts of the world are we having these doctors come?
Yeah, so just like last year, we're having doctors who are coming from the US, we're having doctors who are coming from Canada, we're having doctors who are coming from Ghana, who also have a local experience treating the same breast that we have. And we have some doctors who are coming from Italy.
Wow. So our patients have this pool of qualified local and international
doctors, yeah. And that gives them a lot of assurance and a lot of exchange in terms of learning between what we do and what they do, and then we combine for the best experience of the patient. Yeah.
I think this is a golden opportunity because for a long time, most of the Kenyans, when we think of this kind of surgery, we think India first and other parts of the first world countries. And the other thing when you hear about this is the cost. Patients paying, or is it Africa?
Someone else will pay for it. And that's why we are lucky we have social health insurance, which covers for breast reconstruction cases. And we are hoping that then it will be able to cover most of the cost for the camp. So it's free as long as you're registered by the social health insurance, because that's the insurance that will cover for you. Yeah.
Thank you so much, Dr. Antuwere.
Yeah, I'm looking forward to having the patients coming in next week for their surgeries.